Today we're diving into the specifics of the epidermal growth factor receptor test, or EGFR, in immunohistochemistry. This test plays a crucial role in understanding certain types of cancer, especially non-small cell lung cancer, or NSCLC. Pre-test information. Before undergoing the EGFR test, there are a few essential pre-test preparations that your healthcare provider will require. Make sure to provide a copy of your histopathology report. This report includes detailed information about your tissue sample, which is critical for accurate test results. Additionally, the site of the biopsy and your clinical history are key components. These details help the pathologist understand the context of the sample and ensure that the test is tailored to your specific case. Test specification. Now let's talk about the specifics of the EGFR test. This test is designed to detect the presence and level of epidermal growth factor receptor in tumor cells. EGFR is a protein on the surface of cells that, when mutated, can drive cancer growth. The test helps in identifying whether certain cancers may be responsive to EGFR-Tyrosine kinase inhibitor therapies. Diseases associated with EGFR. The EGFR test is particularly significant in diagnosing and managing various cancers. It is most commonly associated with non-small cell lung cancer, NSCLC, but it can also be relevant in other cancers like colorectal cancer and head and neck squamous cell carcinoma. Specimen used. The specimen used for the EGFR test is typically a tissue sample obtained from a biopsy. This tissue sample is then prepared and stained in the laboratory for analysis. Components of the test. The components of the EGFR test include the tissue sample, specific antibodies that bind to the EGFR protein, and a detection system that visualizes this binding. The result is a stained tissue section that a pathologist can examine under a microscope to determine the presence and level of EGFR. Test report time. One important aspect to keep in mind is the test report time. After your biopsy is taken, it usually takes about 7 days to get the results of the EGFR test. This time frame allows for the careful preparation and analysis of the tissue sample. Test information. Finally, let's talk about why the EGFR test is so important. As mentioned earlier, EGFR serves as a prognostic marker in various tumors. In the case of non-small cell lung cancer, the presence of EGFR mutations can indicate whether a patient might respond to specific targeted therapies, such as EGFR-Tyrosine kinase inhibitors. This information is vital for personalizing treatment plans and improving outcomes.